Breast cancer. Incidence: 1 in 8 women will be diagnosed with breast cancer in their lifetime. It is the most common cancer among women worldwide. The symptoms of breast cancer can vary depending on the type and stage of the disease. Some common signs and symptoms to look for include lumps or thickening in the breast or underarm area, changes in the size or shape of the breast, dimpling or puckering of the skin on the breast, nipple discharge, especially if it is bloody or clear, redness or scaling of the nipple or surrounding area, itching or rashes on the nipple or surrounding area, nipple retraction or inversion, swelling of all or part of the breast, pain or discomfort in the breast that is not related to the menstrual cycle. It is important to note that these symptoms do not always indicate the presence of breast cancer, and many other conditions can cause similar symptoms. It is important to have any new or unusual changes in the breasts evaluated by a healthcare provider. Regular breast cancer screenings, such as mammograms and clinical breast exams, can help to detect breast cancer early, when it is most treatable. Causes: the exact cause of breast cancer is unknown. The factors that increase the risk include age, family history, certain gene mutations, exposure to estrogen, radiation exposure, and alcohol consumption. Breast cancer is diagnosed using a combination of medical tests and imaging studies. The exact tests and procedures used may vary depending on a person's symptoms, age, and other risk factors. Some common diagnostic tests and procedures used to diagnose breast cancer include physical exam. A healthcare provider will perform a thorough examination of the breasts to look for any lumps, swelling, or changes in the appearance of the skin. Mammogram. This is a type of X-ray that can detect breast tumors that are too small to feel. A mammogram can also help to determine the size, shape, and location of a tumor. Ultrasound. This test uses high-frequency sound waves to create images of the inside of the breast. It can help to determine if a lump is solid, a possible tumor, or filled with fluid, a cyst. Magnetic resonance imaging, MRI. This test uses a magnetic field and radio waves to create detailed images of the inside of the breast. An MRI can help to detect small tumors or cancers that are difficult to see on a mammogram. Biopsy. A biopsy is a procedure to remove a small sample of breast tissue for laboratory analysis. This is the only way to definitively diagnose breast cancer. Blood tests. These tests may include a complete blood count, CBC, or other tests to check for any signs of cancer or other conditions that may affect treatment options. Types. There are two main types of breast cancer, ductal carcinoma and lobular carcinoma. Ductal carcinoma begins in the ducts that carry milk to the nipple, while lobular carcinoma starts in the lobules that produce milk. 1. Invasive ductal carcinoma. IDC is a type of breast cancer that starts in the milk ducts of the breast and invades the surrounding tissue. IDC makes up the majority, about 80%, of all breast cancer cases and can spread, metastasize, to other parts of the body, such as the bones, liver, lungs and brain. Symptoms of IDC may include a new lump in the breast, changes in the size or shape of the breast, and fluid discharge from the nipple. IDC is typically diagnosed by physical examination, mammogram, biopsy, and possibly other imaging tests. Treatment options for IDC may include surgery, radiation therapy, chemotherapy, hormone therapy and targeted therapy. 2. Invasive lobular carcinoma, ILC, is a type of breast cancer that starts in the milk-producing glands, lobules, of the breast and invades the surrounding tissue. Unlike invasive ductal carcinoma, which starts in the milk ducts, ILC spreads, infiltrates, more evenly through the breast tissue, making it more difficult to detect on a mammogram. Symptoms of ILC may include a new lump in the breast, changes in the size or shape of the breast, and thickening or swelling of the breast. ILC is typically diagnosed by physical examination, mammogram, biopsy, and possibly other imaging tests. Treatment options for ILC may include surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy. It is important to work with a healthcare team to determine the best course of treatment, as ILC can be more difficult to treat than other forms of breast cancer. 3. Ductal carcinoma in situ, DCIS, is a type of non-invasive breast cancer. This means that the cancer cells are still contained within the milk ducts and have not spread to the surrounding breast tissue. CIS is considered a precancerous condition and, if left untreated, has the potential to become an invasive breast cancer. Symptoms of CIS may not be noticeable and the condition is usually detected through routine mammogram screening. Treatment options for CIS may include surgery, such as a lumpectomy or mastectomy, radiation therapy, and possibly hormonal therapy or chemotherapy. The choice of treatment will depend on the size and extent of the CIS, as well as the patient's overall health and personal preferences. Patients have to closely monitor their condition to detect any changes that may indicate progression to an invasive cancer. 4. Lobular carcinoma in situ, LCIS, is a type of non-invasive breast cancer that starts in the milk-producing glands, lobules, of the breast. LCIS is considered a precancerous condition, as the cancer cells are still contained within the lobules and have not spread to surrounding tissue. LCIS is usually asymptomatic and is often detected through routine mammogram screening. LCIS is considered a marker for increased risk of developing invasive breast cancer in either breast, rather than a true precancerous lesion. Women with LCIS have a 7 to 10 times higher risk of developing invasive breast cancer compared to the general population. Treatment options for LCIS may include close monitoring and regular mammograms, hormone therapy to lower the risk of developing breast cancer, and/or prophylactic surgery to remove one or both breasts, prophylactic mastectomy. The choice of treatment will depend on the individual's overall health, personal preferences, and family history of breast cancer. 5. Inflammatory breast cancer, IBC, is a rare and aggressive form of breast cancer. It is called inflammatory because it often causes redness, warmth, and swelling in the affected breast, due to blockage of the lymphatic vessels by cancer cells. IBC is considered a locally advanced breast cancer, meaning it has spread beyond the original site in the breast and may have invaded nearby lymph nodes. Symptoms. Symptoms of IBC may include sudden and rapid swelling of the breast, skin changes such as redness or thickening, warmth to the touch, and persistent breast pain. IBC is often diagnosed through a combination of physical examination, mammogram, biopsy, and imaging tests. Treatment options for IBC may include surgery, such as mastectomy or lumpectomy, radiation therapy, chemotherapy, and/or targeted therapy. IBC is often treated with a combination of treatments, as the cancer cells tend to be more resistant to traditional chemotherapy. It is important for individuals with IBC to work closely with their healthcare team to determine the best course of treatment and to closely monitor their condition. 6. Triple-negative breast cancer, TNBC, is a type of breast cancer that does not have receptors for the hormones estrogen and progesterone, or the protein HER2. This means that TNBC does not respond to hormonal therapy or drugs that target the HER2 protein. TNBC makes up 10 to 20% of all breast cancers and is more common in younger women, women of African or Hispanic descent, and women with a BRCA1 gene mutation. Symptoms of TNBC may include a new lump in the breast, changes in the size or shape of the breast, and thickening or swelling of the breast. TNBC is typically diagnosed through physical examination, mammogram, biopsy, and imaging tests. Treatment options for TNBC may include surgery, such as mastectomy or lumpectomy, radiation therapy, chemotherapy, and/or clinical trials for new and innovative treatments. TNBC tends to be more aggressive than other types of breast cancer and requires a multidisciplinary approach to treatment. It is important for individuals with TNBC to work closely with their healthcare team to determine the best course of treatment and to closely monitor their condition. 7. HER2-positive breast cancer is a type of breast cancer that tests positive for the HER2 protein. HER2-positive breast cancers tend to grow and spread more quickly than other types of breast cancer. The HER2 protein plays a role in the growth and division of cancer cells. HER2-positive breast cancers make up about 20% of all breast cancers. Women with HER2-positive breast cancer may experience symptoms similar to other types of breast cancer, such as a new lump in the breast or changes in the size or shape of the breast. Treatment options for HER2-positive breast cancer may include surgery, such as mastectomy or lumpectomy, radiation therapy, chemotherapy, and targeted therapy with drugs that specifically target the HER2 protein. These drugs, known as HER2-targeted therapy, can help slow the growth and spread of HER2-positive breast cancers. 8. Metastatic breast cancer, also known as advanced or stage 4 breast cancer, is the most serious form of cancer. It is cancer that has spread beyond the breast to other organs in the body, such as the bones, lungs, liver or brain. Metastatic breast cancer is not a separate type of cancer, but rather the most advanced stage of breast cancer. Metastasis occurs when cancer cells break away from the original, primary, tumor and enter the bloodstream or lymphatic system. These cells can then travel to other parts of the body where they can form new tumors. Metastatic breast cancer often has the same characteristics as the original tumor. Metastatic breast cancer is a complex disease, and treatment for it often involves a combination of surgery, chemotherapy, radiation and/or hormonal therapy. The goal of treatment is to control the spread of the cancer and to relieve symptoms. In some cases, the cancer can be managed for a period of time, but it is not curable. Treatment. Treatment options for breast cancer include surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and immunotherapy. The type of treatment will depend on the type and stage of the cancer, as well as the patient's overall health. Despite advances in treatments, metastatic breast cancer remains a challenging disease. Research is ongoing to better understand the biology of the cancer and to develop more effective treatments. The systemic drug treatments for breast cancer include chemotherapy, hormonal therapy, targeted therapy, immunotherapy, bone-directed therapy. 1. Chemotherapy is a systemic treatment for breast cancer that uses drugs to kill cancer cells. It works by stopping or slowing the growth of rapidly dividing cells, including cancer cells. Chemotherapy can be administered orally or intravenously and can be given alone or in combination with other treatments such as surgery or radiation therapy. The drugs used in chemotherapy for breast cancer target cells in different stages of the cell cycle, and different drugs may be used depending on the type and stage of the cancer. Some commonly used chemotherapy drugs for breast cancer include adriamycin, doxorubicin, Cytoxan, cyclophosphamide, Taxol, paclitaxel, and gemcitabine. Chemotherapy can have side effects, such as hair loss, nausea, vomiting, fatigue, and increased risk of infection. These side effects are usually temporary and subside after the treatment is finished. 2. Hormonal therapy is a systemic treatment for breast cancer that works by blocking hormones that can fuel the growth of certain types of breast cancer. The two main types of hormonal therapy for breast cancer are aromatase inhibitors, AIs. These drugs block the production of estrogen, a hormone that can fuel the growth of hormone receptor-positive breast cancer. AIs include drugs such as arimidex, anastrozole, aromasin, exemestane, and femara, letrozole. Selective estrogen receptor modulators, SERMs. These drugs work by blocking the effects of estrogen on breast tissue. The most commonly used SERM for breast cancer is tamoxifen. Hormonal therapy is often used in postmenopausal women with hormone receptor-positive breast cancer, and can be given alone or in combination with other treatments such as chemotherapy or radiation therapy. It may also be used in premenopausal women after they have undergone surgery to remove their ovaries, which are the main source of estrogen. Hormonal therapy can have side effects, such as hot flashes, joint pain, and vaginal dryness. These side effects are usually manageable and subside after the treatment is finished. It's important to discuss the potential benefits and risks of hormonal therapy with a healthcare provider to determine if it's the right treatment option for a particular individual. 3. Targeted therapy is a type of systemic treatment for breast cancer that works by targeting specific molecules or genes that are involved in the growth and spread of cancer cells. Unlike chemotherapy, which affects cells throughout the body, targeted therapy is designed to specifically target cancer cells while minimizing harm to normal cells. There are several types of targeted therapies for breast cancer, including A. Monoclonal antibodies. These drugs are designed to target and block specific proteins that are involved in the growth and spread of cancer cells. Examples of monoclonal antibodies used in the treatment of breast cancer include Herceptin, trastuzumab, Perjeta, pertuzumab, and Kadcyla, trastuzumab emtansine. B. Tyrosine kinase inhibitors, TKIs. These drugs target proteins called tyrosine kinases, which are involved in the growth and spread of certain types of breast cancer. Examples of TKIs used in the treatment of breast cancer include Ticerb, Lapatinib, and Nerlynx, neratinib. C. PARP inhibitors. These drugs target proteins called poly-ADP ribose polymerases, PARPs, which are involved in repairing DNA damage. Examples of PARP inhibitors used in the treatment of breast cancer include Lynparza, olaparib, and Talzenna, dilazeparib. Targeted therapy can be used alone or in combination with other treatments such as chemotherapy or hormonal therapy. It may also be used in patients with specific genetic changes, such as mutations in the BRCA1 or BRCA2 genes. Targeted therapy can have side effects, such as skin rashes, diarrhea, and decreased blood counts. These side effects are usually manageable and subside after the treatment is finished. It's important to discuss the potential benefits and risks of targeted therapy with a healthcare provider to determine if it's the right treatment option for a particular individual. 4. Immunotherapy is a type of systemic treatment for breast cancer that works by boosting the body's natural immune system to fight cancer cells. Unlike chemotherapy and hormonal therapy, which target cancer cells directly, immunotherapy helps the immune system to recognize and destroy cancer cells on its own. There are several types of immunotherapy for breast cancer, including A. Checkpoint inhibitors. These drugs target proteins on immune cells that normally prevent them from attacking cancer cells. Examples of checkpoint inhibitors used in the treatment of breast cancer include Keytruda, pembrolizumab, and Opdivo, nivolumab. B. Cancer vaccines. These vaccines help to train the immune system to recognize and attack cancer cells. Currently, there are no cancer vaccines specifically approved for the treatment of breast cancer. C. Adoptive cell transfer, ACT. This approach involves removing immune cells from the patient, modifying them in the laboratory to enhance their ability to attack cancer cells, and then infusing the modified cells back into the patient. This approach is still in the experimental stage for the treatment of breast cancer. Immunotherapy can be used alone or in combination with other treatments such as chemotherapy or radiation therapy. It is typically used in patients with advanced or metastatic breast cancer who have not responded to other treatments. Immunotherapy can have side effects, such as fatigue, skin rashes, and increased risk of infections. These side effects are usually manageable and subside after the treatment is finished. 5. Bone-directed therapy is a type of systemic treatment for breast cancer that works by preventing or treating bone complications associated with the disease. Breast cancer can spread to the bones and cause pain, fractures, and other complications. Bone-directed therapy helps to prevent or treat these complications and improve quality of life for patients with breast cancer. Types. There are several types of bone-directed therapy for breast cancer, including A. Bisphosphonates. These drugs help to slow down the rate of bone destruction and reduce the risk of fractures. Examples of bisphosphonates used in the treatment of breast cancer include Zimida, zoledronic acid, and Iridia, pamidronate. B. RONCL inhibitors. These drugs target a protein called RONCL that is involved in the development of bone-destroying cells. Examples of RONCL inhibitors used in the treatment of breast cancer include Xgeva, denosumab, and Prolia, abandronate. C. Radium-223. This is a radioactive isotope that delivers radiation directly to the bones, where it can help to slow down the growth of cancer cells and reduce the risk of fractures. Bone-directed therapy is typically used in patients with breast cancer that has spread to the bones, especially in patients with a high risk of fractures or other bone complications. It can be used alone or in combination with other treatments such as chemotherapy, hormonal therapy, or targeted therapy. Bone-directed therapy can have side effects, such as bone pain, joint pain, and decreased blood counts. These side effects are usually manageable and subside after the treatment is finished. Prevention. To reduce the risk of breast cancer, women can adopt a healthy lifestyle, such as maintaining a healthy weight, getting regular exercise, and avoiding alcohol. Undergo regular screening, and consider genetic testing if they have a family history of the disease. How to differentiate between benign breast disease and breast cancer. Benign breast diseases are non-cancerous conditions that can cause symptoms similar to those of breast cancer. However, there are several key differences between benign breast diseases and breast cancer that can help to differentiate between the two. Some of these differences include tumor size and growth rate. Benign breast tumors tend to be smaller and grow more slowly than malignant, cancerous tumors. Tissue type. Benign breast tumors are typically made up of different types of cells than malignant tumors, and they do not spread to other parts of the body. Lumps. Benign breast lumps are often smooth and round, while cancerous lumps are often irregular and hard. Nipple discharge. Discharge from the nipple is usually not a sign of benign breast disease, but it can be a sign of breast cancer. Pain. Benign breast diseases are typically not painful, while breast cancer can be. Family history. Benign breast diseases are not usually associated with a family history of breast cancer. While a family history of breast cancer is a risk factor for developing the disease. Diagnostic tests, such as a mammogram, ultrasound, and biopsy, can also help to differentiate between benign breast diseases and breast cancer.